Hi there, welcome to today's presentation of health issues, in which I will be discussing the basics of the management of diabetes in people living with the condition. And remember, listeners, to subscribe to this channel if you have not already done so in order to get any notification as soon as I upload a new video onto this channel. In this presentation of the basics of the management of diabetes in people living with the condition, it is worth noting that in people without diabetes, there is the production of insulin by the body, which converts any excess glucose in the body into glycogen for storage. At any time in the future, when the body needs more glucose, which is not available from food intake, then the glycogen that was stored is converted back by glucagon into insulin that is readily usable by the body in times of need. However, in people living with diabetes, the pancreas is not able to produce the insulin that is needed to convert any excess glucose to glycogen for storage in that manner. And therefore, there is no interplay between or interconversion of the glucose to glycogen and glycogen back to glucose when necessary. In this situation, glucose will accumulate in the blood. This is not a healthy situation. And therefore, there is need for the awareness of deviations from the normal glucose levels and the urgency of measures that must be taken to re-establish a balanced glucose level in the body. When glucose is accumulated in the body, leading to hyperglycemia, the body tends to use fats in order to produce energy instead of the glucose. And these mechanisms lead to the production of ketone bodies. These ketone bodies lead to acidic system in the body. This situation is known as diabetic ketoacidosis. It is the reason why ketones must be monitored also when glucose levels are recorded as high, especially for people living with diabetes. It is also not a good situation when the blood glucose level goes below the required level. This will lead to a situation of hypoglycemia. In both extremes, listeners, the situation is not a healthy situation, and there is urgent need to re-establish the balance or the sugar level to a balanced target level, which is stated according to the care plan of the individual. In failure to re-establish a balanced system or to re-establish the glucose level to the target levels, there is likelihood for further deteriorations, and further deviations from the norm leads to deterioration of health of the individual. It is therefore the objective of this presentation to raise the awareness of the importance of urgent action which must be taken once blood glucose levels are tested to be high or low for people living with diabetes. In the situation of excess ketones in the body due to uncontrolled excess glucose in the body, the diabetic ketoacidosis results. And if this situation is left to go unchecked or uncontrolled for long, there is the likelihood of the individual suffering further complications of their health due to these deviations. The kidney will be challenged as it struggles to handle the excess glucose in the body. Other body organs will also be affected as they come into play in struggling to maintain these excess glucose levels. It is therefore necessary to seek medical assistance and intervention immediately once the glucose level goes be out of the target range, listeners. And in acute and long-term care settings, the care staff will need to know it is urgent an imperative to test for ketones when the blood glucose levels are raised for diabetic subjects or patients with diabetes under our care. Without these measures, the quality of life of the individual is further compromised, as this can likely lead to situations of diabetic coma and shock, which in most cases may be irreversible. However, with the timely intervention, there is the possibility and the great chance of re-establishing life in deviations. It is therefore imperative, listeners, to urgently seek medical intervention if you are living with diabetes in the community or at your home and you notice a big deviation or a significant rise in your blood glucose levels, and if this has to go any length of time uncontrolled. And for acute and healthcare service staff, listeners, it is worth checking the blood sugar and the glucose, the blood glucose level, as well as the ketones at the planned times, and to take the necessary actions when they fall above the target range, and to further escalate and seek for assistance when necessary. With this, we are sure to sustain the quality of life for people living with diabetes, listeners, and for those in the community to be able to re-establish their quality of life by prompt and robust action to deviations in blood glucose levels. Watch out, listeners, for more presentations, and again, subscribe if you have not already done so, so as to get notifications as soon as they are presented on the channel. See you and bye for now.